My husband, John, is going to ask the question. We're from Smithtown, Long Island, New York.
So my question is, I've been keeping my blood work for about 50 years. I eat a plant-based diet, but I'm very confused. Every blood test, I'm hoping I get a better result, but it's always high cholesterol, borderline diabetic for years. I tried statins a little bit, but I'm wondering if I can, my ratio is always below 5, and my VLDL, which I just learned from you guys, is more important than LDL, is low, 13, 15. So, I'm 72, I'm mowing 2 lawns, I'm transplanting shrubs, very active. Am I a ticking time bomb, or can I take solace in the ratio and the VLDL, and I'm eating a healthy diet? I rarely get sick, almost never. And so please comment on that.
So I think you're obviously eating a very good diet. You mentioned that your numbers may not be perfect. I think that it comes down to more of what the bigger picture is of who you are. American Heart Association, American College of Cardiology has a risk calculator where we can plug in some numbers. We can look at what your blood pressure is, your specific cholesterol numbers, your age, your ethnicity, whether you're a smoker, whether you're diabetic, whether you're on blood pressure medicines. We can come up with a calculation of what your 10-year risk is. Depending on what that is, would indicate whether something more than just your good, healthy, whole food, plant-based diet would be of benefit. And even a coronary calcium scan could add to that. So I think it's a good conversation to have with your physician.
All right, thank you very much.
Joel, would you like to ask a question, and where are you from?
I am from Ashland, Massachusetts, and I would very much like to thank the panel. This is just a remarkable discussion. Here's my question. A cardiologist puts someone on a statin who has not had any coronary events previously, and that patient simultaneously adopts an optimal whole food plant exclusive diet. And a year goes by, 2 years, 3 years, and they stick to the diet perfectly. How do they know whether they can come off the statin? Are they removed for a while to see whether the diet is improving their markers, or what exactly do they do? Or should we view statins as a lifetime prescription?
That's a good question.
Go ahead, Heather.
And I think that's another situation where it depends on more about what else is going on with that patient, whether they have hypertension, diabetes, family history, what their baseline lipid levels are. Because we don't just take a statin just to lower cholesterol, we take it to help stabilize plaque and reverse plaque in the arteries. So I think there's a lot of nuance to that question. It's a good question to have with their cardiologist or primary care physician. If their baseline risk is low, if they're not a diabetic, they don't have high blood pressure, don't have a family history, then maybe the statin is not something that is going to be of much yield to reduce risk. Whereas if they have other things that are risk factors, then maybe that statin, even in spite of a good whole food plant-based diet, may be something of benefit to reduce risk.
We found out that as long as our seminar has been going on, we have any number of patients who arrive at our seminar, and they have already found out they simply can't take statins. They either have severe muscle cramps, or it's been injuring their liver, or it's given them diabetes, or it's given them brain fog. They cannot take statins. And they do absolutely just as well as the patients who are taking statins, providing they follow our program. Because it's very exciting that the statins, when you think about it, are lowering cholesterol, but even patients who are taking statins, that sometimes gives them a very false sense of security, and they're still eating these horrible foods that are destroying their endothelial production of nitric oxide. And this is why you never see a patient or a study with statins where they absolutely completely wipe out all disease. Right. because these patients are still creating their disease by how they've eaten. Yeah.
Ray, would you like to ask a question, and where are you from?
From Chicago, and I'd like to thank you, Steve, and the panel. I have maybe a whole food plant-based diet. And I recall in the last 50 years, I went to the hospital once. And when I went there, the doctor that did see me said that I should not be whole food plant-based. And she made basically fun of me. And what can one do to protect yourself if they find that whatever emergency situation? Is there anything that you can recommend that we can show that doctor information to say, look at this person differently in terms of whatever test they might want to apply or speak to?
Well, I think all treatment is predicated on an absolutely rock solid diagnosis. And I really, with all due respect, I haven't heard from you what this diagnosis was about. What was this fear of whole food plant-based nutrition by this physician you encountered?
He's been muted, so he can't answer. He's muted.
Okay.
Okay. David, would you like to ask a question, or where are you from?
Yes, I'm David from California, and I hear you very carefully, and as well as the other presentation in this conference. And I still have to say that I'm quite confused regarding the oil. I'm a vegan and I don't have any symptom, but I did coronary calcium scan and got relatively high results. But from the other hand, I did omega score test and show that I have seriously deficient in omega. So the score should be over 5 and I have only 1. So in such a situation, from one hand, I understand that oil is not good for the heart, but from the other hand, omega-3 is important for the heart and from other things. And although I take walnuts and grind flaxseed, should you recommend increased consumption of oil in order to fix the omega-3 deficiency, or not because of the heart issue and the calcium score?
I think I know Dr. Esselstyn's answer to this question. I think it's going to be a solid no.
You mean as far as omega-3?
I think his question was adding oils, whether he should be adding oils to improve his omega-3 ratio.
Oh, God, no. Oh, no. Oil, the oil will, our data would suggest that oil injures the endothelial lining. And if you would go to your computer, you can actually, if you go to my website, dresselstyn.com, you can look up under articles. You can see the paper that I wrote. It's a short editorial about the problems with oil and how the animal studies and the human studies showing how the oil is injurious.
Ruth Lynn, would you like to ask a question, or where are you from?
I'm from Canada, Ontario, and I would like to know, for a woman on a plant-based diet, how much B12 each day would you recommend? And also, someone sent me an article about having water just before you go to bed, 2 glasses for the heart. Okay, and then I'm getting up in the night about 2 times to go to the washroom. So I'm just like to have an answer, and thank you so much, all of you.
Hydration is definitely important for heart health. I don't know where the recommendation of 2 glasses at bedtime comes from. I'm not sure there's a rationale for why you should need to drink water specifically at bedtime. Perhaps move those to earlier in the day if you're having issues with going to the restroom in the middle of the night.
I think I would totally concur with Dr. Shenkman. I would agree. As far as the amount of B12, I rely pretty heavily on a Cleveland Clinic physician who specialized in B12 metabolism. And he was suggesting that at least 500 micrograms a day up from 60 to 70, and after 70, that would be 1,000 micrograms a day. Now, the reason for that is that as we do become more senior, there are 2 factors in our stomach that decrease. One is our gastric acidity, and the other is the intrinsic factor, both of which have to do with our absorption of vitamin B12. And so he suggested over 70, maybe 1,000 micrograms a day.
Stephanie, would you like to ask a question? And where, I'm sorry, did you want to finish something, Dr. Shenkman? Okay, Stephanie, would you like to ask a question, and where are you from?
Hi, I'm from Washington, D.C. And my question was about the nitric oxide. I know in the beginning with the question about being heart attack proof, you mentioned the importance of nitric oxide. So my question is, A, how do you protect the nitric oxide that you do have? And B, like, how do you stop it from depleting, as you age and stuff? Thank you.
Yeah, well, what we do for our patients with heart disease to enhance their nitric oxide values are two approaches. One is to further stimulate the endothelial production of nitric oxide, and then the second is to take advantage of the newer research that shows us that mankind has an alternate pathway for making additional nitric oxide. So I asked these patients to chew, not smoothies, not juicing, but to chew a green leafy vegetable 6 times a day that's approximately the size of half of your fist, after it has first been steamed 5.5 to 6 minutes so it's nice and tender, and then you must anoint it with several drops of a delightful either balsamic or rice vinegar. Why? Because the acetic acid of those vinegars has been shown to increase the nitric oxide synthase enzyme, which is contained within the endothelial cell and responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich. That's 3, mid-afternoon 4, dinner time 5, and of course I adore it when you have that evening snack of arugula or kale. Now, the second benefit from chewing the green leafy vegetable is that it restores the capacity of your bone marrow to once again make the endothelial progenitor cell. What do? The endothelial progenitor cells will replace our senescent, injured, worn out endothelial cells. Now, the third benefit, and the most important of all, when you're chewing a green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce that green nitrate to a nitrite. Once you swallow the nitrite, it is now your own gastric acid, which is going to further reduce the nitrite to more nitric oxide, which can enter your nitric oxide pool. Now, there's a catch into this, but first of all, think about it. What you're doing with minimal expense, no hideous side effects, all day long from dawn to dusk, morning to night, you are absolutely replacing nitric oxide, the very molecule, the deficiency of which gave you this disease in the
Your screen froze, Dr. Esselstyn. We've lost you now for the last 30 seconds, so. Still frozen. Still. Okay, so Dr. Esselstyn, you are frozen, so I am going to temporarily move on. I apologize. Nancy, would you like to ask a question, and where are you from?
Yes, so my question has to do with nitric oxide. And I know Dr. Esselstyn recommends cooked vegetables or, green leafies. I'm trying to be high raw, and I'm wondering if I can still get the same effect if I use those dark green leafy vegetables raw. And then also, would natto help to build my heart health as well as my bone health?
I can't answer you about natto. I just don't feel that I have that information at the tip of my fingers. But as far as the vegetables go, yeah, I don't really think that you're going to be in trouble if you're eating it raw. There's going to be a lot of, but the data I'm familiar with is that cooking helps somewhat to break down the cell membrane, so that when you chew these after they've been cooked, you get perhaps a greater benefit of the phytonutrients. But I think you can try it raw, yes.
Julie, would you like to ask a question, and where are you from?
Hi, yes, this is Julie from Yonkers, New York. And Dr. Esselstyn, I was wondering about your aside against taking your green vegetables as a smoothie. I thought I was protecting my health by starting my day every morning with a green and fruit smoothie.
You probably would be okay. The reason I don't like the smoothies so much is that many people will find that just a green smoothie is too tart. So they'll throw in an apple, an orange, or a banana to sweeten it up. Now, I have no problem with eating an apple, an orange, or a banana, but when you take it and you beat it up in a mixer, you now have separated the fructose from the fiber. So instead of the absorption, usually when you eat the fruit alone, it's nice and safe and slow. Then when you do the smoothie with all the fruit in it, and now you have the fructose is like a rocket going off in your stomach, which can injure the liver, and injure the endothelial cells.
Another practical point about smoothies as opposed to eating your greens and your fruits and vegetables is that you're going to have less satiety if you are blending these things up all into a drink and glugging them down. Whereas if you're actually biting into something and chewing it, eating it more slowly, you're probably going to fill yourself up better.
Good point.
Bill, would you like to? Sorry.
Yeah,
Bill,
I was gonna ask the questions Dr. Esselstyn about the nitric oxide, but it was answered. So I just want to say kudos to Dr. Campbell for doing his research on an experimental vaccine and not taking it. I wouldn't take it either.
I want to make a comment on that. This is a conversation that needs more time, but I want to make it very clear. This is just for myself. I have no position with regards to what others choose to do, none. So I don't want people to say, okay, I did what I did. Now probably that's not my point.
Mike, would you like to ask a question, and where are you from?
Yes, thanks, Steve. I'm from beautiful Fountain Hills, Arizona. And part of my question, well, I guess the question is that a lot of times when I've heard the conference and others talk about animal protein and so forth, we never break that out into like maybe how it's cooked. There's a great spectrum of the way things are cooked. There's, steak tartare, which is barely cooked at all, if any. We've got barbecued ribs. You've got things on the grill that are overcharred. You've got undercooked or overcooked chicken. So I'm wondering if any of the studies ever looked at or controlled for the cooking of certain animal proteins because if they undercook it, or overcook it, there's dangers either way. I'm just wondering if that was ever considered in any of these studies.
Well, since I get the protein question, I guess, the cooking, insofar, the main feature of the protein as to what it does or doesn't do really has to do with the kind of amino acids that are present. And so animal foods have a composition of amino acids that are rather different from plant foods, and animal foods are like our own protein. So that's one question. The cooking thing, though, does raise the question in the minds of some, and there's some data on this, that it produces these agents called heterocyclic amines, and they have been shown, at least in animal studies, to be carcinogenic at the very high doses. But I think that question is almost moot, because I wouldn't eat the food in the first place, either cooked or uncooked, because the amino acids don't change whether they're cooked or not cooked. And so that's where the discussion really should be, is on the amino acids.
Lorraine, would you like to ask a question, or where are you from?
Hi, I'm Lorraine from Camarillo, California. I'm an 81-year-old woman, completely plant-based. I eat a lot of food, a lot of vegetables. It's really hard for me to get in my protein. I want to know what you think of me eating egg whites a couple of times a week, and also pea protein or hemp protein smoothies with no fruit.
Well, there's the general consensus now emerging, it's quite reliable, I believe, the data support this, that plants provide all the protein we need. And in addition, the protein of plants actually creates a better response than the protein of animals. So there's absolutely, I know of no evidence now that we need to consume animal food in order to get the protein. We can get it all from plants.
Yeah, right now it's interesting that increasingly in the last decade or so, professional athletes are turning to plant-based nutrition because they have greater stamina and a quicker recovery time.
Okay, if each of you could make a 30-second closing summary comment, and then tell us how we could stay in touch with you, get in touch with you, find out about your latest book. Also, everyone, if you go to our website under the bios, we have links to everyone's website and their books. So that's another way to get it. But if you could each make a closing comment and let us know how the best way to stay in touch with you is.
Ladies first.
Thank you for the opportunity to speak and to be part of this panel. I am surrounded by giants here in awe of Dr. Campbell, Dr. Esselstyn, and Dr. Williams, and all of your work that you've done. My message is, I'm an interventional and preventive cardiologist. I am very much an advocate for plant-based diets to prevent heart disease in the first place and to treat heart disease when it does exist, to help improve outcomes with plant-based eating. My own approach is to marry that with an evidence-based approach to treating heart disease with medications where appropriate. My book is The Vegan Heart Doctor's Guide to Reversing Heart Disease, Losing Weight, and Reclaiming Your Life, available on Amazon. It's basically what I want to teach my patients about what heart disease is and how you can improve your heart health for years to come. I'm in Tarzana, California. If you want a consultation with me, I can see you in person, or if you live in California, I can see you via telemedicine and provide individual guidance. Best way to find me is my website, www.drheathershankman.com. It's got all my links and things there, and a link to my book.
Thank you very much.
Yes, I happen to work at the Cleveland Clinic Wellness Institute, which is where I have the counseling seminar. Just briefly, I guess what really keeps me going still some beyond 20 years since I retired from surgery, I really see on the horizon what could truly be a seismic revolution in health. And this seismic revolution in health is never going to come about through the invention of another drug, another pill, another stent, another bypass operation. But the seismic revolution in health will come about when we in the profession have the will and the grit and the determination to share with the public what is the lifestyle, and most specifically, what is the nutritional literacy that will empower them to absolutely annihilate chronic illness. Thank you, and I guess I'll be seeing, since I have a presentation with Steve's group tomorrow, I guess I'll be seeing some of you again tomorrow. Thank you.
Thank you.
I'm reminded of one thing, of a question I often hear, and that is, this information certainly has made a lot of progress, I think, in the last couple of decades, but still, there's so many people, are a difficult time trying to accept this and try it. And I've often been asked, what's the best way to do that? And Steve, I would suggest what you're doing is really one of the really primitive ways to do it, namely holding these kind of things. The public discussions of this sort, the more we can get that kind of discussion going, I think we can engage the public and get questions and answers. So that's an important point. And I would just leave one additional comment to follow up what Dr. Esselstyn just said on nutrition. I've been in this field for, more than 65 years, and it's been a great deal of fun, but at the same time, it's a topic, it's a discipline that really struggles to be heard. And my point at this point in my career is that we have tended to think of nutrition on a nutrient basis. At least it gives rise to a huge confusion. And it turns out that when the nutrients are all consumed more at the same time and Mother Nature has a chance to work with them, it's a dynamic that's very different from what has been discussed before. Everything just sort of works together in what I call a holistic fix. So I think just understanding nutrition and having that kind of discussion is a really important point to make. It's certainly been a pleasure talking to all of you.